Did you know the sun or the wind can cause a growth on your eye? Well, we have a condition called a pterygium, which is actually a triangular piece of tissue that grows in the 3 9 o'clock positions in our eye. And from the wind UV exposure, as a defense mechanism, our body grows this tissue. Now, in the early stages, we don't have to really do much about it. Sometimes these can get inflamed and we actually have to put a topical medication, an anti-inflammatory on the eye to help control it. But for the most part, patients are in complete comfort. And what brings them into the office sometimes is the unsightly growth that they see in the mirror. Now, in the mild stages, again, we just kind of watch that and do nothing besides measure it. If the tissue continues to grow, it will actually induce astigmatism, which then we have to prescribe maybe different eyeglasses that compensate for the vision changes. And if it continues to grow towards the visual axis, surgery is recommended. We actually have to dissect that tissue, and we could use different tissues like amniotic tissue in that healing process to kind of really keep that cornea nice and clear, and the patients do very well with it. We commonly see this condition in our patients that are outdoor workers like construction workers or even boat fanatics, driving at high speeds with the wind hitting their face. A very simple way to either prevent it or help slow down the growth of it is wear sunglasses with UV protection in the lens to limit wind and UV light exposure. And it should help slow it down and or prevent these from ever even forming in the first place. So if you're diagnosed with a pterygium, don't be alarmed. See your healthcare provider or your eye doctor and allow them to measure the tissue. In the event that it grows, they'll recommend surgery. They may be unsightly, but they can be managed very well.